Hello and welcome to the demonstration of EazyHMS Doctor module. Once again, I'll log in as admin, but you can see the landing page is set for the doctor. Let's start with the login. So at the first, you can see the doctors can view their patients, appointments, screening, consult date, and medical discharge, and IPT patient assigned to him. So doctor can directly jump to the screening completed. So these patients are ready to move in the room. So let me select which ones are ready. So once you pick any patient, so doctor can view the all the vitals, what are the consumption, smoking and drinks, any allergy. So at the once medication allergy for the paracetamol. So doctor can aware. So before giving any medication, he can look at the past visit, any complaints, a view summary, or any other detail that doctor want to look at the previous encounter. So let's jump on the chief complaint. So here we have given this nice template with the buttons, so doctor doesn't need to type anything. So this can be configured as per the specialty. So doctor doesn't need to look at the different areas. So just click the itching and blurry vision. So just a click and the chief complaint is noted down. Still, if there is thing that doctor want to add additional comment. Okay, so more chief complaint. History of presenting illness, same way they can click and see the location, where the context in the evening while on the big meal or something. So this has to be relative. Again, this can be configured, changed as per the requirement. Modifying factor, what are the location, intensity, severity, what is the timing, at what timing the problem is appearing. So like worse at the night, itching is worse at the night. So that's how we have done with the history of presenting illness. Also with the buttons, we can have the smart phrases to select the 10 complaints and the history of presenting illness, and the ROS, revision, physical examination, eyes, lipid, pupils. Here we can have the detailed things like conjunctivitis, so it is normal. At normal, it is a left eye or right eye or both. So that's it. So in just a few clicks, we have covered the chief complaint, history of presenting illness, review of system, physical examination. So input, we can add provisional diagnosis and the final diagnosis at once. Right now we have given this as a ICD-9 database. We can have the ICD-9 and 10 both database for the diagnosis. So let me just select. You can add the additional comment here. So chief complaint, provisional invoice, you can see provisional diagnosis, you can see the dashboard. If doctor wants to order anything according to doctor specialty, this landing page again is configurable. Doctor can set his or her favorites. So just click lipid profile and save. The order has been given. So this is how this order can be just placed to the laboratory dashboard. Patient needs to go to the laboratory and put this give the sample. So this is how the things are connected. Medicine, if doctor want to prescribe medicine without any orders, they can start here. Let's say any other tab 5 mg, and for the 10 days frequency is what. If they want to add any instruction, we can do that. Add row at once. Any other medication, just pick 200 mg for 10 days. If you select again the BD and quantity will be automatically calculated. Save medication. Once you save medication, this can be printed and this will be available in a pharmacy directly. Now, if doctor want to take any other doctor's reference, so he can refer, please check with things. So submit. So patient doctor has uh, taken this all the chief complaint, HPA, ROS, NP, and diagnosis, order some test and prescribe some medication. Still want to consult with another cardiologist or any other specialties doctor. Doctor has just referred to clinic. Okay. Oh, okay. Consultation is completed because we are at the start. We have taken the consultation started and consultation is completed. If after looking at any patient, doctor want to admit any patient, like after, so here we have the button admit this patient. Okay, on single click this will be available to the dashboard. And for Pankaj Vanzari, if doctor want to see any view summary or anything, you can see the details. Presenting complaint, history of present illness, medical history, social history, family history, and vitals. Plan and Alex. So this can be printed. Now, whatever the doctor has done, like doctor has referred to another clinic, doctor requested for any IPD admissions, so that can be seen by the front desk. Let me show you on another screen, like in a on a dashboard, OP dashboard. Here you can see the OPD, any future appointment, OP referral as so just let me click on the OP reference. Like here you can see the patient is listed in OP referral, is referred to another doctor. Same way we can see the list of admission requests for the Munal. Doctor has advised to admit her. So on just click on admit. You can see the click the doctor, which ward, VIP, room. This is again the available things. That's it. On a single click, patient is admitted to ward. And for the OP referral, front desk has to do some work as they need to take appointment. Book an appointment. Here you can look at the slots available and you can look the appointment for charter patient. So that's it. So appointment is done and the patient can go to the specific doctor's screen. So this is how the doctor noting is done, and whatever the orders has been placed by the doctor, those are available directly in a lab dashboard. So you can see the Pankaj Vanzari lipid profile and CBC. We can take the sample like this. So this will be covered in a rest module where will see the laboratory, radiology, and rest modules. Thank you very much.